Welcome to this Clinical Preferences webinar. I'm Dr. Christine Stang, and today I'm going to walk you through the importance of clinical preferences and how setting up your preferences can affect your treatment plan. Let's dive in. By the end of this course, you will be able to identify where to access the clinical preferences on the Spark Aligner site, understand the importance of clinical preferences and how they affect the treatment plan, be comfortable with the Spark Aligner's default protocols, and how to communicate effectively with the design team. So these learning objectives are super important because clinical preferences are your default settings for all of your cases. The prescription form is then the individualized settings for each patient and needs to be completed for every patient. It's important to note that the prescription form will override your clinical preferences. This is why it's important to understand these forms and its defaults. It will help you communicate more effectively with the designers and improve the efficiency of your setups. Once you have your Spark account, you will go to the upper right-hand corner where you will see your name. Use the drop-down menu to select clinical preferences. There will be pre-selected options. These are the Spark default settings, which are applied automatically by the software. You also have the option to specify if you want something different in each section. So shown here are the three different sections in clinical preferences. The first is the final tooth position. Just as it sounds, in this section, you will communicate what you want to see at the end of treatment. The second is the staging section. You will set up how you want that final position. And lastly is the features, is where you will note what you are going to use to increase predictability of the case. Let's go ahead and begin with final tooth position. You will start by selecting your anterior leveling. You have three different options and the opportunity to customize. It's important to always make a selection here since the software is going to make the alignment automatically. And then the designers are going to follow what you have indicated in the prescription form and the rest of the preferences. The pre-selected option for Spark is going to be Smile Arc 555. Smile Arc 555 means that the laterals are going to be 0.5 millimeters above the centrals and the canines 0.5 millimeters above the laterals. You can also have laterals at 0.5 above, which some people feel the last option is actually more aesthetic, but it's not going to affect the predictability of the case. This is just a matter of how you like to design the smile. Lastly, you can make your selections by using one with or without the grid. Next, the pre-selected option for fully aligned teeth before IPR is going to be yes. The reason is when you have a crowding case, you don't have access to do the IPR. In this video example, we have 0.5 millimeters of IPR. If we do the IPR during the first two stages or at the beginning of the case, we might compromise the anatomy of the tooth. So we recommend to not fully align everything, but rather to create space first so you have better access to do the IPR. On stage number 16, we're going to have the IPR. At the end, then we will close and tighten the contacts. If we don't have space for movement, we are not going to see the rotations, intrusions, or extrusions play out. This is going to help to create a little bit of space around the tooth so the plastic can grab the whole tooth. Creating space will make the case more predictable because, as you know, friction is an opposite force to movement. When it comes to IPR, you will receive this sheet with your aligner box, and you can also download it at any time in the Approver software. The software will tell you in which stage you need to do the IPR. On this sheet, it shows the IPR on all lower incisors on this particular case. So now let's talk about expansion. The first option is to maintain space with IPR. To create the space, we are going to send you the case with IPR. If you want to reduce the amount of IPR, you have two options. The first one is less than 2 millimeters, and the other option is more than 2 millimeters of expansion. It's important to remember that you have two different types of expansion. Relative expansion is like proclination of the crown. Pure expansion is moving, like doing a translation and moving the crown and roots at the same time. When it comes to pure expansion, what is considered more predictable is 2 millimeters per quadrant. If you want to keep your case more predictable and still have a nice arch form while reducing the amount of IPR, then less than 2 millimeters is the recommendation. More than 2 millimeters is going to overexpand the arch, but that is up to your discretion. However, it's important to remember that clinically, less than 2 millimeters is what we consider more predictable per quadrant. You have three options to choose from for the arch form with Spark: the natural arch form, the Damon, which is a broader arch form on the upper and lower, as well as the parabolic arch form, which is technically the same as the Damon arch, but with compression of the second molars. So remember, if you want to work with natural, but on a specific case you want to use the Damon arch, you definitely can. The take home here is you can specify that on the prescription form itself, because the prescription form overrides the preferences. The last section within the final tooth position option is the posterior crossbite. Here you would select if you want to correct the posterior crossbite during the initial setup, and if you want to use cutouts for all the teeth in the crossbite. If you don't want to correct the crossbite because, let's say, the occlusion is stable, it's important for you to specify that on the prescription form. If you don't specify that on the prescription form and keep the default, your designer will send you a correction for the crossbite, and you're going to receive the case back with button cutouts to use elastics. Remember, with the 3D controls in Approver, you can remove those buttons as well if you don't want to use them. So in addition, at the end of each section of the clinical preferences, you have a comments box for the case. It is really important to be specific on the things you want and how you want them, as well as itemizing your instructions. Next up, let's move on to staging. Regarding staging, we need to review active and passive aligners. Active aligners are aligners with movement, and passive aligners are aligners without movement. If you don't want passive aligners, just simply uncheck the box. With active aligners, you have the option to slow velocities to match the arch with more stages. This is for a case where you have more movement on a specific arch. So here you will have the option to choose more active aligners. With Spark, you have the option to use additional passive aligners at the end of treatment. You need to specify the amount of additional passive aligners you want at the end. Spark aligners, as you know, comes in 3 product options: Spark Advanced, Spark 20, and Spark 10. And you can select always add passive aligners regardless of the product type. So during Spark 10, if you have 10 active aligners, and in order to receive 3 passive, you will then need to upgrade to Spark Advanced or Spark 20, and an upgrade pop-up will appear in the software. Your other option here is to select only add passive aligners to Spark 10 and 20 when it does not affect the product eligibility. This means if you have 10 aligners, or if you need 10 aligners and you have a Spark 10, we are not going to send you the additional passive aligners. The maximum number of passive aligners you can add is 10. Please note that we don't recommend using passive aligners as retainers. Let's dive into the virtual C-chain, which is used to tighten the contacts at the end of treatment. If you request virtual C-chain, you will receive 3 additional aligners at the end. And you have 2 options. The first is 3 to 3, canine to canine. The second is 7 to 7 or second molar to second molar. Simply select the option you prefer. It's important to specify that you want to use the virtual C-chain aligners on the prescription form because it's not something we use on every case. So in this video here, we have 3 to 3 virtual C-chain, and this is the final position. This is from an anterior view and from an occlusal view. Here we are going to tighten the contacts and we will receive 3 additional aligners. Let's go ahead and do a quick review of the virtual C-chain. You will tighten the contacts at the end of treatment. Remember, 3 to 3 is canine to canine and 7 to 7 is second molar to second molar. It's important to select if the patient needs C-chain or not and what type. You will receive 3 additional aligners at the end of treatment if you select virtual C-chain. And the virtual C-chain could be a great option for spacing cases or cases with IPR. So as with the final position, you have a place to add in comments for staging. Remember, it's important to be specific on the things you want and how you want them. Lastly, just a reminder, it is good practice to itemize your instructions. Now let's get into features in the final section in clinical preferences. So if you want to delay the placement of attachments, you will delay the complex movements as well. So keep that in mind. So you will delay movements like rotations, intrusions, extrusions. These type of movements, as we know, require attachments. You may wish to delay the placement of attachments. Maybe if you want to take more time with your patient to explain how aligners work and their hygiene care during their first appointment. It is really important to specify that you want to delay the placement of attachments and the stage you want them to occur. However, as we know, attachments are really going to help you make your case more predictable, as you will change the direction of force or apply force where needed. So this is a list of attachments that are automatically placed by the software. This means you don't need to specify the attachment that you want for intrusion, extrusion, or a combination of movements like extrusion and rotation, distal in rotation, mesial in rotation, and lastly, mesialization and distalization. If you want something different from the default settings, you need to specify it. So on the chart here, you can see for intrusion, the threshold is going to be 0.5 millimeters, and you will have a beveled attachment, a horizontal bevel attachment, and it's going to be placed on the upper and lower molars. When it comes to our combination of movements like extrusion and rotation, we're going to use the sash attachment. The threshold is going to be 0.5 millimeters of extrusion and 5 degrees of rotation. This attachment is going to be placed on the upper laterals and upper and lower canines and premolars with the same threshold as the extrusion movement of 0.5 millimeters. For extrusion, you will have a horizontal bevel attachment, and it's available on the upper and lower anterior teeth as well as premolars. For rotation, the threshold is 5 degrees. It will also be a bevel attachment, but instead of being a horizontal attachment, it's going to be vertical. The position or placement of the bevel is going to depend on the orientation or the type of rotation that we have. For mesialization and distalization, the threshold is 1 millimeter. We use a vertical rectangular 3 millimeter attachment. And if you want to change to a bigger attachment, you would need to specify that in the preferences. The preferred attachment for extrusive movements is going to be a horizontal beveled attachment, which is the default setting. The bevel is always going to run against the movement. If you would like to change that orientation to an incisally beveled attachment, you would need to select that option. We do not recommend removing attachments because that can compromise the movement or you may have tracking issues. For rotations, instead of using a horizontal attachment, we will use that vertical attachment. You can select it beveled in the direction opposite to the movement. So if you have a mesial rotation, the thinner end is going to be towards the distal, or it can be beveled in the same direction as the movement for a mesial end rotation. So then the thinner end would be towards the mesial. And you can also specify, of course, if you want something different. So let's get into the preferred attachment for a tooth with an elastic hook section. The default is going to be a horizontal rectangular attachment on the same tooth as the elastic hook. You have the option to use a vertical or a bevel attachment or no attachment at all. We recommend to always use an attachment with these elastic hooks, but it is up to your discretion. Now, with a button cutout case, the default is a horizontal rectangular attachment on the same tooth. You can select a vertical attachment or no attachment at all. If you select the vertical attachment, but if you have extrusion, instead of getting that vertical attachment, you will automatically get back a horizontal bevel attachment because you will need that for that extrusive movement. It's important to note that the attachment will be based on the type of movement needed. If we happen to have conflicts between attachments and hooks, it will be indicated by an orange attachment. This is because you have a collision, or you don't have enough space to have two different features on the same tooth. If this is the case, you have a decision to make. Your first option, or the default, is to reduce the size of the attachment to accommodate the hook and the cutout, or you can remove the hook and keep the attachment, or remove the attachment and keep the hook. If you remove the attachment, you may compromise that movement and not have the retention you need. This is why we recommend the default of reducing the size of the attachment. You can also move the hook or the cutout to the adjacent tooth, which is also a good option. So for a class 2 case, here the default for elastic placement is the hook on the upper canine and the button cutout on the lower first molar. You can change that if you prefer to have only buttons, and you can also change the hook for a button. If you prefer to have 2 buttons instead of 1, of course, that's an option as well, and you can specify that, and your designer is going to make the change on your case. For class 3 cases, the default is going to have a hook on the lower canine and a button cutout on the upper first molar. If you have a class 3 and you are going to retract the anterior to have an ideal overjet, you can use a hook due to the force of the elastic on the aligner. Also, changes in preferences applies to all of your cases. So if you want to make a change on one case, you will need to do that on the prescription form as well. If you have a missing tooth or if you are going to do an extraction, it's important to indicate if you want to use Ponix. So the default will be yes, that you want to use Ponix, because with Ponix, of course, you minimize the appearance of a missing tooth. So if you select yes, Ponix will be automatically placed by the software on a space greater than 4 millimeters. And this only applies to the posterior because on the anterior, you will get a Ponix automatically. This is also good to prevent tipping of the adjacent teeth while we are closing on a space. When the default is yes and you don't want a Ponix, it's important for you to specify no. And remember, if you have a Ponix, you will get space. You will need to fill that space in office with the material of your choice to minimize the appearance of the missing tooth. Thank you so much for taking this course.